Just today I had somebody ask me in regards to putting off their knee surgery, what were some good activities or some good exercises outside of, say, the wellness modalities that can help them push off that knee replacement or that knee surgery. And here are 5 of my favorites. All right, so this first one, pretty simple. Now, one thing I would advise is just making sure you have something to hold on to if you're a little weary about your balance. But in this case, if you have, say, a band, just a light low resistance band with, in this case, we have a little strap that can go around the upper part of my quad, just above the knee. Or if you just have, say, a traditional thicker resistance band that you may see at your community fitness center, you're gonna wrap it around, say, a bar. You want it basically just slightly above your knee, or basically quad height. You're gonna stand in a split stance position similar to like a lunge. All you're going to do is lower yourself down and fight that resistance from pulling your knee inwards. In this case, I'm pulling it across slightly so I can work more of my adductors. This basically is just gonna help strengthen some of those muscles that surround the interior part of the knee, especially if it feels a bit unstable on the interior aspect of your knee. Now, the other version of this is flipping it around the opposite direction, which I'll show you here. So now this is the flip side of that same activity. So instead of working my adductors, I'm now working my abductors, which is the lateral muscles here that run along the lateral aspect of my quad going down to the side of my knee. Again, this is to kind of help with stability purposes, and if you feel any instability of the knee on the lateral and medial aspect of the knee. And you're just gonna hold this for 30 seconds. If you start to feel like this is pretty easy, then you can start doing some lunges and still try to hold that position without the knee getting pulled inwards by the band. Typically, I'd say 30 seconds for a hold, 8 repetitions in each direction. Another one of my favorites is doing some leg extensions. Basically, you're gonna sit at the edge of a chair or table. If you have ankle weights, those are perfect. Just wrap them around your ankles. If you don't, you can grab a little band and wrap that around your ankle as well, and basically attach it to something like the leg of a chair that's back a bit, just to create a little bit of resistance. And simply all you're gonna do is point your toes up towards your shins. You'll start with one leg at a time. You're gonna extend it up, hold 30 seconds, and then back down. The idea of this is just to kind of strengthen more of those muscles of the quad that surround the knee, just to create a bit more stability for that joint and more strength. Take some pressure off of the joint. Another great activity, just some ball on the wall squats. This is very good if you feel like you have limited range of motion for your squats, and if you're a little worried about your squat pattern, because this will help make sure you stay in the right position. Basically, just gonna start with your feet hip width apart. From here, I'm just gonna hinge at the hips, push my butt back, squatting down, standing back up. Big thing here, you just wanna make sure you don't lean back into the ball, all the movement's coming from the hips. Typically, I'd recommend anywhere from 8 to 10 repetitions for this one. Another great activity, and for those of you who have worked with me in training sessions, you know these and you love these, band walks. Basically, for these, you're gonna simply put them around your ankles or just slightly above the ankle. Start at, say, one point of the room, go down to the other point. I wouldn't say do 100 yards, but at least 10 to 20 yards. You're gonna have a slight bend in your knees, slight squat position, and you're simply going to step and walk laterally going down and back. Big thing on this one is making sure we're not turning our feet out. Our toes are pointed forward, and we're stepping and walking without dragging the back foot or letting the band snap us together. And my 5th favorite activity here would be some simple step-ups. Now, I always advise make sure you're standing next to, say, a bar, or if you're at home and you're doing these, stand next to, say, a counter that you can put either both hands on or at least one hand on. For the step box, it doesn't need to be super tall. You just want to have a slightly elevated surface. If it really hurts the knee, then go down a height. But something that doesn't bother the knee itself, but you feel it within the legs. And simply all you're going to do from here is step straight up onto the box and back down. Always want to make sure you're not pushing too far forward. You're driving through your foot and you're stepping straight up. This is great for improving unilateral strength and stability of the leg, basically creating a nice strong foundation surrounding that knee joint. And now, say after you finish the workout here with me or one of our other wonderful exercise specialists, what I would definitely advise would be doing either the infrared sauna, great for relaxation and recovery post-workout. I'd also advise doing a little bit of red light directly to the knee to reduce inflammation. And lastly, I would advise doing a little bit of compression therapy to help boost some of that circulation, reduce any inflammation, help you feel better after your workout.